Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see classification number 18, that is the diuretics and anti-diuretics drugs, which is very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 17 classification videos. If anybody has not seen those videos, please go in the channel's playlist and watch all those videos, because those videos are very important for your GPAT Niper DI Pharmacist exam preparation. My dear students, before knowing the classification of diuretic drugs, you should know what do you mean by diuretics. What is the structural and functional unit of kidney, different parts of nephron, and process of urine formation. So I would like to explain you these things in a very short. First, what do you mean by diuretics? So diuretics are the drug which will increase the urine formation and which will increase the volume of urine, known as a diuretics. So basically these drugs will increase the urine formation and excrete the more urine from your body. So obviously they are going to decrease your blood volume. So these drugs are used in the various conditions, for example hypertension, congestive cardiac failure. They are also used in the edema or to increase the excretion of drugs in case of overdose of drug or drug poisoning. So basically the structural and functional unit of kidney is known as a nephron. Structural and functional unit of kidney is known as a nephron. So nephron will have different parts. Nephron. So what are the different parts of nephron? So first, or capsule-like structure is known as a glomerulus. This structure is known as a glomerulus. This one is known as a Bowman's capsule. Okay. Now second part known as a proximal convoluted tubules. After that, this loop-like structure, that is known as a loop of Henle. Again, this spiral structure is known as a distal convoluted tubules. And lastly, this is known as a collecting duct. These are the parts of nephron. You should know the process of urine formation in a short. So urine is formed in the body in the different steps. First step is nothing but the glomerular filtration. It is also known as ultrafiltration. Okay. So filtration of blood. Okay, in the glomerulus, known as a glomerular filtration. Now this filtration is because of the difference in the pressure, because of the difference in the diameter of afferent blood vessel supplying blood to the nephron and efferent blood vessel taking blood away from the nephron. So due to difference in the diameter, there exists a hydrostatic pressure which is the driving force for filtration of blood. So everything is filtered from blood except blood cells and plasma proteins. Whatever nutrients are there, whatever sugars are there, whatever amino acids, salts, water, everything is filtered. Now all these filtered nutrients along with the water and ions, so they are not excreted in the urine. So 99% of filtered blood or filtered water is reabsorbed into systemic circulation, and that is the second step. Second step is nothing but the selective reabsorption. So nutrition, they are required for your body, sugars, amino acids, ions. So they are required for your body and they are reabsorbed from the PCT, loop of Henle, and some part of DCT. So PCT means proximal convoluted tubule, DCT means distal convoluted tubule. Nutrients and essential element or essential, water is essential, sugars are important, amino acids are required, ions are required, so they are reabsorbed. So 99% whatever blood is filtered, so that is reabsorbed. Only 1 to 2% that is excreted as a urine. Now nutrition or those vitamins or those ions which are extra in your blood to secretion, they are actively secreted in the lumen of your nephron. Okay, so process of urine formation has a 3 step. First one is a glomerular filtration, second one is a selective reabsorption, third one is nothing but the active secretion. So these are the process of urine formation. Now what are the categories of different drugs? Diuretics are classified into different types depending upon their chemical structure, depending upon their mechanism of action, depending upon their site of action. So first classification, depending on the site of action, whether diuretic will act on a proximal convoluted tubule or loop of Henle or distal convoluted tubule or collecting duct. So depending on that, diuretics are classified according to their site of action. So first site is nothing but this proximal convoluted tubule. Second site is nothing but the late end of your PCT. Third site is nothing but the loop of Henle. Fourth site is nothing but the primary or initial end of your distal convoluted tubule. And fifth target or fifth site is nothing but the late distal convoluted tubule. So different drugs will act on these sites. Carbonic anhydrase inhibitors like acetazolamide, dorzolamide, brinzolamide, they will act on a site 1 proximal convoluted tubules. You have to remember this question उसके ऊपर आ चुका है. Now at the site second, that is a late end of PCT. Osmotic diuretics will act on late end of PCT like sugars, then urea, water, then mannitol and glycerin, etc., etc. Then site 3, there is a loop of Henle. So loop diuretics will act on this site. Loop diuretics, for example, furosemide, bumetanide, then ethacrenic acid, etc., etc. So they will act on this third site. Now diuretics that act on a fourth site, proximal end of distal convoluted tubule or initial area of DCT. So they are nothing but thiazide diuretics. So thiazide diuretics or benzthiazide, hydrochlorothiazide, they will act on this site, site 4. Last site, that is the end of your DCT. So at that site, your potassium sparing diuretics, they will act. Potassium sparing diuretics, they will act on this site. Antidiuretic hormone or antidiuretic, that is ADH or vasopressin, that will act on a collecting duct part of your nephron. So that's how diuretics drugs and antidiuretic drugs has a site of action. So these drugs will act on a different site, like on first site carbonic anhydrase inhibitor, like on the second site osmotic diuretics, on the third site loop diuretics, on the fourth site thiazides diuretics they will act, on a fifth site potassium sparing diuretics will act. So you have to remember the sites and examples of drug that acts on a particular site. So this is the first classification. Now we'll see the second one. Diuretics drugs, they increases the urine formation together with natriuresis, means volume of urine. Okay. Last example and important characteristic. So first, diuretics are classified into different or depending on their efficacy. So whether they are effective in the formation of more urine or less urine. First one is a weak diuretics. So weak diuretics means they are known as a weak ceiling diuretics or low ceiling diuretics. Weak diuretics are also known as a low ceiling diuretics. Okay. What are the example? In that you have osmotic one. So sodium and potassium salts, they are weak diuretics. Xanthines. So they are example aminopylene, caffeine. They are again weak diuretics. Carbonic anhydrase inhibitor like acetazolamide, dorzolamide, they are also weak. Now second class is nothing but the moderately effective or moderately efficacious diuretics or moderately sealing diuretics. So in that you have osmotic one, example mannitol, isosorbide, sucrose and glycerol. Then thiazide diuretics, benzthiazide, hydrochlorothiazide. Then thiazide like diuretics, so like chlorothalidone and chlorothalidone, chlorozone, then clopamide, zipamide, indapamide. And they are moderate, they have a rapid onset of action, they will have 8 to 72 hours duration of action. Third category of diuretics are nothing but the very effective diuretics or highly efficacious diuretics or high ceiling diuretics, or it is also known as the loop diuretics. Example furosemide, miflosimide, ethacrenic acid and bumetanide. Okay. Potassium sparing diuretics, in that you have trimetrin, amiloride, spironolactone and ipralenol. Okay. So these are the drugs. Now again we'll see the classification in different types. So according to the site of action, so those drugs which act on a PCT, proximal convoluted tubule. So in that you have carbonic anhydrase inhibitor like acetazolamide, then also spironolactone will also act on PCT. Osmotic diuretics like mannitol, vasodilators or central diuretic like aminopylene. Then ascending loop of Henle, or that is a thick loop of Henle. So loop diuretics basically in furosemide, bumetanide, ethacrenic acid. Then descending loop of Henle, so organic mercurials and thiazide will act. And basically this thiazides they will act on a primary part of your distal convoluted tubule known as a drugs. For example, potassium sparing diuretics, steroidal drug, non-steroidal trimethyl, etc. And according to the efficacy, so they are classified into high efficacy having diuretics, or they are known as a efficacious diuretics, or they are known as a loop diuretics or strong diuretics. Example, furosemide, ethaconic acid. You have to remember. Okay. Now moderately efficacy diuretics. So in that you have thiazide ones, thiazide like chlorothiazide, hydrochlorothiazide, benzothiazides, and polythiazides. Then thiazide like diuretics like chlorothiazide, metolazone, and indapamide. Low efficacy diuretics means weak diuretics. Okay, example, osmotic diuretics like mannitol, potassium sparing diuretic like spironolactone, harmonic anhydrous inhibitors. Again, we'll see the classification by different. So diuretics are classified into majorly three types. First one is nothing but the high ceiling diuretics. High ceiling diuretics, or they are known as a loop diuretics, or they are known as a high efficacy diuretics. They are primarily inhibitors of sodium potassium chloride co-transport. So sodium potassium chloride co-transport inhibitor. Furosemide, okay, or furosemide, then bumetanide, torsemide. These are the drugs. They will act on a loop openly. They are known as a loop diuretics, and they has a one major important adverse effect. They will cause damage to your eighth cranial nerve. They will cause deafness. Remember, question asked that. Now, medium efficacy diuretics or medium efficacy diuretics. They inhibit the sodium chloride symport. So in that you have thiazide diuretics. Thiazide like benzothiazides like hydrochlorothiazide, hydrochlormethazide, and benzothiazide. Thiazide like diuretics. So thiazide like means they will not have a structural resemblance to thiazide one. They will not have a similar structure to thiazides, but they will act like a thiazide. They will have a similar mechanism with thiazide. So chlorthalidone, then metolazone, zipamide, indapamide, and clopamide. These are thiazide like diuretics. Now third category of diuretics, they are known as a weak diuretics or low efficacy diuretics. So high ceiling, they are known as a high efficacy diuretics. Then medium efficacy diuretics and low efficacy diuretics. So in the low efficacy diuretics, or in that you have first carbonic anhydrous inhibitor like acetazolamide, dorzolamide, brinzolamide. Okay. Then second class is nothing but the osmotic diuretics. So in that you have mannitol, isosorbide glycerol. So remember, mannitol is a drug used to decrease the intraocular tension, used to decrease the intracranial tension in the head injury or cranial operations. Potassium sparing diuretics. So in that you have aldosterone antagonists like spironolactone and ipralenone. These are known as aldosterone antagonists. So this spironolactone will have steroidal structure. So it will cause hirsutism in the female. उसका adverse effect होता है, it will cause hirsutism in the female. Hirsutism मतलब unwanted hair growth. Then again it will cause gynecomastia in the males. उसका एक active metabolite होता है. You have to remember what is the active metabolite of spironolactone. That is a canrenone. Canrenone is the active metabolite of spironolactone. Then ipralenone. Now renal epithelial sodium channel inhibitors. In that you have amiloride and trimethyl. So these are the diuretics. Now anti-diuretics, and they will increase the blood volume. They will decrease the urine formation. They will increase the blood volume. So in that you have anti-diuretic hormone and its analog. So ADH, anti-diuretic hormone, is also known as vasopressin. So उसका एनालॉग दूसरा होता है डेमोप्रेसिन, लाइप्रेसिन, टेलिप्रेसिन. वे देखो इसमें सब प्रेसिन ही है. क्या है इसमें? प्रेसिन. प्रेसिन्स आर नथिंग बट द एंटीडायरेटिक हार्मोन एनालॉग. देन नाइट्रियूरेटिक्स, तो इसमें आता है थायराइड एंड अमीलोराइड. सो नाइट्रियूरेटिक्स. मिसलेनियस में आता है कार्बामाज़ेपिन व्हिच इज देन chlorpropamide, that is anti-diabetic drug. Indomethacin, it is a NSAID. Carbamazepine is a CNS depression drug. Carbamazepine antipsychotic में आता है. Then chlorpropamide is anti-diabetic drug. Indomethacin is a NSAID. So these drugs are also antidiuretics. So you have to remember the classification: diuretics, antidiuretics classification, which is very important for you. GPAT Niper DI Pharmacist. Again we'll see in short drugs and their mechanism of action. First one is a carbonic anhydrous inhibitor, acetazolamide. So it inhibits the carbonic anhydrous in the proximal convoluted tubule. What is the effect on it, right? So it will excrete the sodium, potassium, and it will increase the carbonate ion. So that's why it can cause acidosis, that is the adverse effect. Okay. Loop diuretics, ethacronic acid and furosemide. So inhibition of sodium potassium chloride co-transporter in the thick ascending limb of Henle. So they are known as a loop diuretics. They will act on a loop of Henle. They will increase the sodium excretion, potassium excretion, calcium excretion, magnesium excretion and chloride excretion. अभी सोडियम का एक्सक्रीशन, पोटेशियम का एक्सक्रीशन बढ़ाएगा, कैल्शियम बढ़ाएगा, मैग्नीशियम बढ़ाएगा, तो हाइपोनाइट्रेमिया ऑफ सोडियम लीड्स टू हाइपोनाइट्रेमिया, hypokalemia, hypocalcemia, hypomagnesemia. So these are will be the adverse effect. It causes alkalosis, systemic alkalosis. Then thiazide diuretics, they will act on a distal convoluted tubule, primary part of distal convoluted tubule. So they inhibit the sodium chloride co-transporter in the DCT. So they will cause excretion of sodium ions, potassium ions, chloride and calcium chloride, and they will decrease the excretion of calcium ion. So all ions are excreted, sodium, potassium, chloride, except calcium. So they can also cause acidosis on the blood. Now last diuretics are nothing but the amiloride, timetrin, spironolactone and epinephrine. So they are known as a potassium sparing diuretic. They will act on a late end of DCT, block the sodium channel, block the aldosterone receptor in the collecting tubule. So they will increase the sodium loss. They will increase the excretion of sodium. They will not excrete the potassium. They will retain the potassium. That's why they are known as a potassium sparing diuretics. So acidosis is again adverse effect. So this is the summary of your mechanism of action and different diuretics. You can order this magic bullet for GPAT Niper DI Pharmacist exam preparation. Read 2-3 times before exam and qualify 100%. This is my WhatsApp number. You can WhatsApp me. We have very much promising result from past few years. You can see. You can also join our GPAT Niper 2024-5 online course. So where you will have live lectures, recorded lectures, study material, test series, etc. Everything is there in 8,000 rupees. And if anybody gets all in rank 20 or below all in rank 20, so fees will be returned to him as a reward. Thank you very much.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100%.